Hey guys, so today I'm going to be talking to you guys about my OB rotation as a nursing student. I'm going to give you guys some tips and something to expect about the whole rotation. Now, this is my second semester, and so this was divided in my school between the second semester. It was half OB and half peds, so we are 48 students and 28 were put in OB, and then the rest were put in peds, and then at the 8th week mark we switched over. So I just finished my 8th week, and I literally just started last week my first peds rotation. I'll tell you guys all I can tell you guys about my OB rotation, and as of right now this has been my favorite rotation. So some people in my rotation have loved OB. Like I have one classmate that she is set that she wants to be a labor and delivery nurse, and then I have some, especially like the males, that just don't really want to do it. But yeah, it's been my favorite. For the most part, everybody seems happy in the OB rotation. The moms are excited and happy, good family, but you do see some things, like I did have some cases that were kind of sad, you know, in fetal testing. But most of them, thankfully, were good patients. But you do hear those crazy stories about like a nurse getting punched in OB triage. But obviously it's because the woman is in so much pain due to labor. So at least at the hospital I was in, OB is split up into a few things. So we had the labor and delivery unit, we had the NICU unit, we had the antepartum, postpartum, and only the girls were allowed in fetal testing. So you have those 5, and for some odd reason every time I would go to labor and delivery, so it's called L&D, I would have pretty bad luck, and I would never, like, it was the day that no C-section was scheduled. There was maybe one patient that was gonna give birth. So every time I would never have such a good luck at L&D, so I would be moved to OB triage, which is where patients go to see if it's really them in labor. So if it is, they will move them to the L&D suites, or if not, they'll send them home, or they'll take them to the antepartum. So they'll see what they do. And usually these women are near, I guess, being able to give birth, and that's the reason they're in triage and not in antepartum. So I was there too. So I was in a total of, I guess, 6. L&D, I had NICU, ante, postpartum, fetal testing, and OB triage. So yeah, I was in 6. Not everybody went to OB triage. It just happened to be that the days I would go or be assigned to L&D, not much was happening. So they would just move me just so I wouldn't be bored. Antepartum is basically like a med-surg floor. You don't do much besides just making sure that the patient is safe and, you know, that they're comfortable being there. Postpartum was probably the most boring. I only went there once, thankfully, but it was pretty boring. Basically, all I did was go check if they were comfortable. They were there, they were happy. I attended a breastfeeding class, teaching new mothers about breastfeeding, and other than that, it was vitals. That's all you did. It was basically like being in first semester all over again, because it was just vitals and seeing, are you comfortable? Do you need anything? Oh, I brought your lunch. I brought your breakfast. Are you done? Can I take your tray? Like, it was basically just that. NICU, I loved. NICU, I mean, it's just, they're little angels, and I know they're sick, but they just bring you so much peace, and you do get to learn so much in NICU. The nurses, since they do have time, everything's scheduled. Like, I would have to take vitals and diaper changes every 3 hours. My babies were feeding every 3 hours, so they had time, you know, to kind of teach me and stuff. So it was just great. I loved NICU. L&D, it's pretty boring, but it is nice. You're basically there as the woman gets prepared to give birth, and then once you're in there, all we were doing was holding the woman's leg, so she wouldn't move them, and yeah, we would see the baby be born, and then we would administer the medications that we would have to administer to the baby, and then, you know, do the assessment, the length of the baby and everything else. Those L&D rooms can really get packed. I was in one delivery where there were like 12 people. It was the patient's significant other, the patient's mom, a doctor with 3 fellow medical students. It was me, my nurse, and 3 other NICU nurses, just in case something happened with the baby. So yeah, it got really hot. And something to tell you guys, if that is how your hospital is going to be, eat that morning and drink lots of water, and maybe don't wear your long sleeve. But yeah, maybe not wear it, because I felt like I was gonna faint because it was actually that hot. And then fetal testing was just amazing. You learn how to put the toco and the fetal heart monitor on the baby, and you just see it to see if everything's okay. And it's just it's like a chill, busy day, because you are pretty relaxed doing everything at your own pace, but you're always busy. So it's really nice. But yeah, those are all the rotations. But now I'm going to tell you guys the tips and what things are good to take on your clinical rotation. This doesn't really mention like OB class, if that's what you guys were wanting. I will do OB class once I finish my semester, because I am taking both OB and peds right now. So one thing that you guys should have, and even nurses would tell me when they see me reading this book, that they would read that book and that it would still be useful for them, is this book. This book is the Maternal Newborn Nursing and Women's Health Across the Lifespan. It's the 9th edition, and it's really, really good. It will tell you, one of the things I read like when I was in NICU was the like I just opened it to this one because I actually read this a few times. The normal newborn. And it will tell you everything to see on a normal newborn. So obviously when you would see something different, you would know, kind of thing. Another thing I forgot to tell you guys is that at least in my school we had to do a care plan. We had to turn one in each day. This book helps you with some diagnoses, so that's really nice. But yeah, it'll tell you characteristics, for example. And let me see. Chapter 1 is the antepartum. So yeah, sometimes when you wouldn't know something, this book would have it. I would look at the index, and something real that you guys in your OB will listen or hear about a lot is preeclampsia. So I would go to the back. I would look for preeclampsia, and it says preeclampsia, eclampsia, about pages 41 to 43. So I'd go, if I know that I have a patient with preeclampsia that day, I would go and start reading preeclampsia, and it says preeclampsia, eclampsia during the antepartum period. So it says here, preeclampsia is the most common hypertensive disorder in pregnancy, and it'll give you the definitions of the types of preeclampsias there are. It'll tell you the management of preeclampsia. So these are things that you might read and be like, oh, you know what, my nurse did do that. It will tell you the antepartum nursing assessments for preeclampsia. So it'll tell you what to assess for, which is really nice. And then it'll give you some nursing diagnoses, and these really helped for when I was doing my daily care plan. So yeah, this book, real good. Next thing that I recommend is this Pearson as well, Maternal Newborn Nursing Reviews and Rationales. I got mine used as on Amazon. The nice thing about this is that you can read a summary the night before if you know that you're going to go to, for example, like antepartum. You know that antepartum has a bunch of preeclamptic patients, or, well, not a bunch, but preeclampsia is a pretty common thing that you might see. So you might want to read about that. If you're going to the NICU, you might be interested in, you know, like chapter 13, the complicated newborn experience, and you just get a brief summary of what you might want to see. It's like, and it'll tell me like the nursing care of high-risk newborn, problems related to maturity, so it'll talk about premature, problems related to size, and this is something that I did hear a lot, small for gestation babies. So you might want to read and see, it's just really small. As you can see, it starts here and it ends here, and then right here it starts large for gestational age babies. So yeah, it's a really good book that you can just easily you know, read a little bit. if you know you're going somewhere especially. Next thing that is very important is drug cards, especially if you are going to be administering medications. So these are my drug cards. I have a few. So basically when we were on winter vacation, our professor sent us an email saying that we had to make drug cards. So they told us to put the classification, the route and dosage, the action, therapeutic effects, contraindications, nursing implications, and side effects. So I have, I don't know how many I have, but I have a good stack here, and honestly I didn't use all of them. Some of the drugs, I wrote them down here that you should know because you do hear these a lot. Obviously, you're going to hear some other ones, but these were the ones that I heard a lot were magnesium sulfate, which is, you know, for to prevent seizures for preeclamptic patients. Erythromycin is if the baby is born healthy, you'll probably be giving this. It's basically like a kind of like petroleum jelly. It's a topical ointment, and you put it in the inner corner, and then you put it like over. And then another one is vitamin K. You administer that to the baby's thigh, and that one is for clotting factors. Betamethasone is another one you hear about. Pitocin, oxytocin, Cytotec, Colace. Those ones I did hear almost every time I was there. I'd hear, you know, or I'd see the patient's chart and I'd hear or see it. So those are some that you should definitely have in mind. So it's very good to know. Another thing is, if you go on Quizlet and you search OB drugs, someone uploaded this Quizlet and it's called OB drugs. And they basically have 25 and they're pretty good. So like here we have magnesium sulfate, OBU, seizure prevention in preeclampsia and eclampsia. So yeah, these are it's really good, and you could just have this on hand. Another thing I told you guys in my last video is Davis. Just, you know, search for example magnesium sulfate Davis, and just see that, and it has everything you need to know just in case you forget your cards at home that day. Know the normal range and the rationale for these tests. It's very important. And treatment and follow-up if any. So you need to know the ABO type, so that's the blood type, and the RH factor, is it positive or negative. You're going to need to know the admitting hemoglobin and hematocrit, as well as the postpartum one for the mother. The Hep B surface antigen, if it's reactive or non-reactive. Rubella, HIV, RPR, group beta strep. For the baby, you need ABO, RH as well. The CRP, Combs, hemoglobin, hematocrit, blood sugar, bilirubin, imaging, and others. So this is like, you know, ultrasounds or x-rays. And you need as well the normal range, the rationale, and if there's any treatment or follow-up. Okay, so basically that's it. That's all you need for a good OB rotation. Learn a lot. Everything there is most likely you not doing it hands-on because it is pretty critical, some of it. But yeah, just learn and see everything, all the medications you have to do, and assess. Trust me guys, there's nothing better than to touch a newborn's like fontanelles and being like, holy smokes, mine isn't like that. Going ahead and touching a fundus. It's things that you don't get to do every day, and if you're in med surg, you should not be touching funduses or fontanelles, or seeing how smart these kids are. You know, holding their little fingers and seeing that their grasp reflex works, you know. Hopefully these tips helped you guys out. Like it if you like this video, and hopefully it helped. Subscribe. Please leave me questions if you guys have any regarding OB. But yeah, that's basically it. Bye.